My involvement with Community Hospital South started back in 1989 when we first decided to purchase or move into an agreement with University Heights to make that part of the Community Health Network system.
The visionary in the whole thing was Bill Corley. And it was Bill saw that as a real good opportunity for the community network. He clearly saw that as someplace we needed to be. They were looking for somebody to assume their debt and provide some capital. Bill said yes.
We basically agreed that we would assume the $26 million debt.
We promised them that we would develop cardiovascular services. We promised them that we would add OB services and that we would add pediatric services.
And we would invest $10 million in the facilities.
And for those who are not Southsiders, they don't understand the vastness of it, the amount of growth, and the need for additional health care.
We added OB, we had pediatric service, and we added a cath lab. And then we realized that we really had to add more to be more competitive.
Well, in the time that I was at Community Hospital South, we continued to see significant growth, and we also recognized that we had some significant limitations to our ability to continue to grow with the Southside population.
Mike Blanchett and the team down there absolutely took over and said, we need much more. And so that's why we're building the $130 million addition to Community Hospital South.
Employees at South have done an incredible amount in growing that facility and growing our services with fairly limited facilities. Now they're going to have the facilities to match up with the capabilities that they have as employees, and I think the combination is going to be really awesome.
We now have the opportunity to build something that prepares us in size, technology, depth of facility and practice for the next 20 or 30 years.
The Indiana Surgery Center is really a key ingredient to the Southside success. They are the entity through which we really developed most of our relationships and maintained and really grew the relationships with all of the surgeons on the South Side. And that is really probably one of the most significant reasons why we've had the success we've had.
When the South Surgery Center was formed, we were able to grow our business a lot and bring a lot of surgeons here that had never really concentrated on South. Then the next step was doing our new surgery suites here in the hospital. And we now have as good as surgical technology as you'll find anywhere in Indiana.
We'd also recognized that we had a need to begin to move towards more private rooms. As everybody recognizes in the Indianapolis market, almost everyone in the city has moved to private rooms, and we were one of the few facilities left that were still operating with about 80% of our rooms being semi-private in nature.
Our private rooms will be bigger than our semi-private rooms, and patients will be able to spend the night with their families. I just think it'll be a much better experience. It'll be a lot more privacy, it'll be a lot more quiet.
With the increasing rate of infections and the types of infections that we have, private rooms is really the safer and more effective way of taking care of patients.
We'll have that personal touch that we've always tried to give the patients, but we'll also have the facilities to go along with that. So we are so excited, it's off the charts here.
The scope of this project really places a stake that says we as the Community Health Network have an obligation to provide the full complement of services on the South Side.
We are in an incredible market here with really a once-in-a-generation opportunity to really grow our business and provide exquisite care for our patients and their families.